What do you say?
So on the 1st of December onwards. On the 1st of December 2022, the UK Medicines and Healthcare Products Regulatory Agency, MHRA, published a summary of the spontaneously reported adverse events, known as Yellow Card reporting, that had been received by the agency between the 9th of December 2020 to the 23rd of November 2022. So it lists 2,362 Yellow Card reports with a fatal outcome. In other words, where the person had received a vaccine and they died, and somebody, maybe a doctor or a relative, reported it as linked to the vaccine. And of these, 1,044, or 47%, were in females, and 1,189, in other words, 53%, were in males. And of these reported fatalities, 809, 34%, occurred in people who were aged less than 69 years, so relatively young people. And then during the 2-year period of assessment by the HMRA, vaccine-associated adverse events, other than fatal events, so non-fatal events, were reported as follows. With AstraZeneca COVID-19 vaccine, a huge number of reports, 246,866. With Moderna, there was fewer, 47,045, and with Pfizer, there was somewhere in between, 177,000 and 900. So it's a very large number of reports. What I couldn't get from the report was how many doses have been given, what's the proportion of the number of doses given, but just taken as ball numbers, very high numbers, and far more than you would expect to see with vaccines. So my comment here, a reported adverse event from a drug or vaccine, for example, sudden death, does not prove causality, although adverse events that are reported frequently and consistently often do point to a true causal association. The risk of vaccination needs to be weighed against the risks of severe COVID-19. Historically, the UK Yellow Card system for reporting adverse events has resulted in under rather than over-reporting. The MHRA's December 22 report on the potential harms of COVID-19 vaccines may therefore have underestimated the scale of the vaccine-associated harms rather than overestimating it. Shall I carry on?
No, just please carry on, yes.
So, leaving aside fatal events, analysis by the MHRA of 2 consecutive years, so they were looking at 2021 and 2022 up until November, and then they stopped analysing. It strongly suggests, I'd say, that COVID-19 vaccination may cause an increased risk of the following serious adverse events, and then I list.
You list them.
And these are ones that they themselves have highlighted as coming up a lot. And so anaphylaxis, that means immediate onset life-threatening allergic reaction. They received 990 reports, mostly with the AstraZeneca product. Bell's palsy, which is a unilateral facial nerve paralysis, so half of your face becomes paralyzed. They seem to imply that they got a lot of reports of that, but the numbers weren't in the report. At least I couldn't find them, and they say that's continuously reviewed. Right, that's what they say. Although at the end of the report they tell us they're stopping routine reviewing, which is a bit odd. Guillain-Barré syndrome, which is paralysis of the lower limbs. It's occasionally seen with other vaccines, but with these particular vaccines, it seems to have been seen quite often. But again, the actual numbers were not disclosed in this report, and at least I couldn't find them. Immune thrombocytopenia, that means, and that sounds pretty grave, because that means you haven't got very few platelets, so you're going to have severe problems with clotting. You won't be able to clot your blood if you cut yourself. And then major thromboembolic events, that means very serious life-threatening blood clots. And there were 486 reports to the MHRA of these, mostly with AstraZeneca, though again, we don't know what proportion of the vaccines administered were AstraZeneca, but mean, assuming they were 1/3, they clearly have been strongly associated with AstraZeneca. Menstrual disorders, huge number of reports to MHRA, 51,000, and the MHRA says they were mostly transient, and we will continue to review this problem. Myocarditis, that's the inflammation of the heart muscle. Again, very large number of reports to MHRA, in my view. 1,241 in total, and 15 of these were reported as having a fatal outcome. And the MHRA comment is the reports are being monitored closely. Pericarditis, which is inflammation of the fibrous sac surrounding the heart. Again, a very large number of reports to MHRA, which were associated with the vaccine, at least in the people reporting them, 954 of these. And finally, transverse myelitis, which is rather rare, very, very rare inflammation of the spinal cord, going right across the spinal cord, would cause paralysis of the limbs, and 179 reports in total, again, most of these originating from vaccination with the AstraZeneca product. And the comment from MHRA was
perhaps can we just I'm sorry, I think you're going on to the comment on transverse myelitis.
Yes.
That the product information has been updated.
Yes, indeed, yeah.
Can we just stop there, Doctor? Because, first of all, the number of UK reports with a fatal outcome received for COVID-19 vaccines by a patient up to and including 23rd of November 2022. So for all vaccines, the total is 2,362.
Yes.
But again, causality is not being established
Of course, yeah, and indeed, and the true number may be higher. It's likely to be higher based on historical underreporting, or it may be lower because there may have been over-reporting. But it's what has been reported. Yes. That's the data as we know it.
I mean, it is possible there's just simply a coincidence.
Yes.
Between perhaps an elderly person who has been vaccinated and subsequent death.
Potentially, although if you see very many of the very, very large numbers are in the middle-aged and young groups there, which wouldn't tend to give that kind of pattern of reporting.
I see. And I think also in table 12, you have that stratified into male and female.
Yeah, there doesn't seem to be much of a difference between male and females. Actually, rather slightly more males, actually. 53% of males, 47% of females. So there is a difference there, yes.